Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, this is your host, Dr. Chen, Physician Director of Practice Sustainability here at the AMA. There are so many evidence-based system-level best practices for improving well-being in healthcare, but it's not always obvious where to start. At AMA Steps Forward, we love to highlight real-world stories from folks who are actively working to put joy back into the practice of medicine. To discuss the Wellbeing 2.0 framework, a roadmap for restoring joy in medicine, I'm joined by our guest, Dr. Hani Chaabo, Medical Director of Wellbeing at Ridgecrest Regional Hospital. Thank you for being here today, Dr. Chaabo.
Thank you, Dr. Chen, for having me. I'm so happy to be here with you.
Well, let's get started. Would you mind telling our listeners a little bit more about yourself and your background?
Absolutely. So I'm board certified in family and integrative medicine, and I'm in the process of doing my addiction medicine board certification too. So I love my job. I wear a lot of hats. I get to practice a lot of different kinds of medicine, but my practice is focused mostly on primary care, mental health, and lifestyle change. We're also the only substance use clinic for about 200 miles here in rural Southern California in the desert. I'm very lucky we have integrated health coaching. I have a 8-week group patient visit program that I do 2 times a year, which is really like one of my favorite parts of doctoring. In my administrative roles here, I wear the hat of medical director of wellbeing, and I'm also chair of our wellbeing committee. So I've understood a lot about well-being and system level efforts that come from both the medical staff side and the administrative side. And I'm really excited to share more with you about that today. I know we're going to dive into it a lot. I'm also core faculty at the American Academy of Family Physicians Leading Physician Wellbeing Program, which is a 1-year training that certifies physicians to take on well-being leadership roles in their organizations. And that's truly like a magical experience to be plugged into the national movement towards well-being, really for everybody in the organization, but especially led by doctors. About my background, I immigrated here from Lebanon about 8 years ago to be a family doctor and to be an American, really, to become a first world citizen, and also to be a proud member of the LGBTQ community. I've had the chance over there in the Middle East to work with the World Health Organization, the United Nations, the World Bank. I've worked on national scale public health projects with the Ministry of Health. And I've also volunteered in refugee camps and worked as a junior physician to marginalized LGBTQ communities like trans Syrian women running away from ISIS terrorism in Syria. So yeah, I've had quite a journey towards what I'm doing today, and I'm very thankful to say it's all been possible because of working with awesome people like you, Dr. Chen, and the team at Steps Forward and the American Medical Association.
That is such a breadth of experience and depth of experience that is so wonderful. And I'm sure it informs all of your work in well-being and how we take care of, each other as well as take care of patients. So that's wonderful. Can you tell us a little bit more about the Wellbeing 2.0 framework and what it is and how it came to be?
Yes. So the Wellbeing 2.0 framework is the first time I heard that term was from Dr. Tate Channefeld's article, Wellbeing 2.0. Dr. Channefeld, for those that don't know him, is basically the father of well-being. I see him as the father of well-being science and healthcare, among many other greats. But I've read so much of Dr. Channefeld's work, and it's informed so much of what we do at our organization. The framework itself is based on 3 pillars. The first is prioritizing well-being at an organizational level. So the people at the top understand why we should be focusing on well-being and really allocating resources towards that focus. The second pillar is optimizing the practice environment. So it's that boiling pot that we all live in, the boiling pot that causes the burnout. That pot needs to be optimized. We need to be looking at the fire under the pot, at the ingredients that are in the pot, at the size of the pot. So for us, that translates into the leaders leading the units, the ways we're interacting with the electronic health record, the ways that we're interacting with each other as a team. And then the third pillar is caring for people. in terms of the support structures and the spaces we have. So, like, the best example of that is a well functioning well being committee, because a well being committee is supposed to be a structure that captures the most burned out among us and is proactive about helping people, supporting them practice medicine, even if they're going through very disruptive periods in their life. And also caring about spaces, like how teams, how close they are to each other, and even things as simple as having like communal spaces where people can interact and have camaraderie with each other. The history of it, I find, is so insightful. Like every time we have a problem, to look at how it developed, because there's so many clues into how to solve it in that history. And I love in the article, it really details, like, from the 1980s until today, how we reached where we are in terms of well-being and burnout in healthcare. And to me, like, watching what's called going from the era of distress, which is before 2005, we were largely ignoring burnout and we were functioning like superheroes. We would have virtually no work-life balance and we'd just keep going and keep going. And that was worn as like a badge of honor. And so when people were being burned out, they were largely ostracized, like there's something wrong with them. And then after that, we went into the era of well-being 1.0, which I like to think of as the era of awareness. And that's when we really started to study burnout and well-being and understand how it affects us, not just as practicing doctors, later on in our career, but also as soon as we enter medicine. Like, when are we touched by this problem of burnout? And so this beautiful body of science started to emerge. And that allowed us to have more conversations with each other as colleagues, to be able to really talk about this problem of burnout, like actually say the word burnout to each other and not be ashamed about it. And so this was a moment where us as like physicians, we were coming together, we were understanding the problem, we were talking about it, there was more vulnerability. However, at the organizational level, we were still focusing on give them some free yoga, give them some free food, like resilience focused efforts, which are important. But the problem of burnout is 80% rooted in the system and the organization. So in 2017, we started to go into the era of well-being 2.0, which I like to call the era of intervention. And this is where national collaboratives started coming together to actually address the problem of burnout. So one of my favorites is the National Academy of Medicine Action Collaborative on Clinician Wellbeing, which brought together more than 200 organizations to look at system level interventions that worked. And if you really want like a quick snapshot to understand what that is, they have a beautiful website where they group things into priority areas and goals, and they have resources for that. But the main idea behind the Wellbeing 2.0 framework was, because of these national collaboratives, we were able to move our understanding from focusing on resilience efforts to focusing on interventions in the system. And so in this way, we were actually looking at things not just from a patient-centric perspective, but also we're caring about everybody in the organization, from the doctors to the front office, to the back office, to the administration. And to me, the Wellbeing 2.0 framework is really grounded in this beautiful idea of intrinsic motivation, and this is something the tech industry does very well, but we're catching on in healthcare, where we look at things like people having a voice and input, or having autonomy and control in their job, or how do they express meaning and purpose in their jobs, and how are we developing them? How are we growing them in their roles and in the things they do, and just as people in the organization? And so the Wellbeing 2.0 framework focuses on these intrinsic motivators and tries to incorporate them at every level of leadership, of functioning, of decision making, and of improvement efforts.
I think you've really, really summed up, the history in a very succinct manner of the well-being movement. So I appreciate that. One of our leaders, Dr. Christine Sinsky, will oftentimes say burnout arises in organizations but manifests in individuals. So I think I want to dive a little bit deeper into that and ask you, how do you think we can assess the current state of our organizations? What are the steps that we need to take
I think that's one of the most important steps from transitioning from the era of distress to 1.0 to 2.0. I think a lot of organizations are still not assessing. And if any one of our listeners is in an organization that's not assessing, I encourage you to speak up and maybe even lead the charge towards assessment in your organization, because without assessment, we won't understand what we need to fix. It has to start with assessment. And I will tell you from our organization, before I became medical director, there was a pause on assessing, because when we were assessing, it was done kind of in a haphazard way. So we were doing assessment, but we weren't doing it in a very effective manner. And then we weren't really coming up with a good strategy with the results, to do interventions with what we know now is the problem. And so for us, we started with partnering up with the American Medical Association, the Joy in Medicine program. We are actually in our fourth year of doing assessments with the Joy in Medicine program. And that has been absolutely transformative for everybody in the organization. But assessment starts with a comprehensive tool. Like the tool that the Joy in Medicine framework uses is called the AMA Organizational Biopsy, which I love very much because it looks at everything from resilience factors, like how are people spending self-care, which is very important, but only 20% of the problem, to how people are experiencing their leaders, how they are spending time in the electronic health record, how much time do they work outside of work, how much work are they taking home. It's the tool that we use for assessment should look at every level of what a doctor feels might be getting in their work. So what I love about I would say the quickest way to see what Wellbeing 2.0 looks like is to look at the Joy in Medicine. There's a one pager that has all the levels of intervention and then goals to hit for each level of award in the Joy in Medicine framework. And so when you look at that one pager, it has leadership, culture, practice efficiency, HR use, support, etc. And so our assessment should be looking at every one of those levels of experience. It's not just important to assess, it's important to have people in place that can interpret those results and then have the heart to actually do something with those results. So often people say, well, okay, we did our annual survey. Great. Like, amazing. You're doing an annual survey. You're understanding your results. That's wonderful. But who's actually doing something with those results? And do they have the proficiency to actually empower others to do interventions that could improve the environments of people that are touched by these results? So for us, assessment wasn't just about assessing how doctors are experiencing their work, but it was also about assessing the leaders who are going to help the doctors do their work. And so people shy away. Like I will tell you, in our organization, the first year we didn't assess leadership behaviors. There was a pushback against that, like drama. We don't want drama. And then the second year, I was able to speak to our executive leadership about intrinsic motivators. And I told them, what you measure becomes culture. So if we take a look at leadership from a tool like the Leadership Index, for example, which incorporates each one of the intrinsic motivators, like every one of the questions is about either voice or input or autonomy or control or meaning and purpose or professional development. If we measure those behaviors in people, they're going to start to model them. And so we started measuring leadership culture in the second and third year, and we saw marked improvement in those scores, like really drastic. We were outperforming the national average on every one of those elements in the organizational biopsy. And so assessment is such an important tool to start with in any organization.
I'm glad that you highlighted our Joy in Medicine program at the AMA. I think it's a very powerful tool for a lot of organizations, and we're very, very proud of all of our team's work in those efforts. I love that you pointed out that you needed to sort of motivate the leadership to take action and to, have that initiative and have the heart to make change. What are the tools that you use to try to motivate your leadership to say, hey, well-being is important and we need to make the investments in time and effort to make the changes necessary? What were the tools that you used?
It's so important to speak their language. I really did not understand the language of the executive leadership until I started to look into things like cost and productivity and, all the financial metrics, all the surrogate metrics of organizational health, like retention. So for me, it was about understanding that language and then being able to speak it. And I'm going to sound like I'm an ad for the AMA. The AMA did not pay me to do this podcast or say all these things, but I have to give credit where credit is due. And so the AMA released the Steps Forwards modules, and one of the most impactful modules for me was about understanding the cost. The cost of burnout to an organization, and then the return of investment. And the AMA has beautiful calculators published based on amazing research that was done on the Steps Forward modules. And I took that first to our CEO, and I showed him how much are we bleeding from this problem called burnout, and how do we stop the bleeding, and what kind of value of investment do we get back? Like, there's a calculator that says we get 23% return on investment, which is pretty high if you're an investor. And so for a CEO, that was, one thing that really helped them understand, okay, like, I'm doing this is going to help the organization. It's also going to help my reputation as a CEO and the reputation of the organization. And I really wanted to show our CEO that when we start to do this framework, within the next few years, we're going to see an improvement in retention and turnover. And we did see that. We actually reduced turnover by more than 40%. And we've been able to hire so many more doctors just because we now have a badge on our recruitment site that says Joy in Medicine Award. So a lot of our doctors now who we're hiring ask us about that. Like, what is this award? How does this make you an organization that I want to come work at? And our CEO understood the value of that from the beginning, and then reaped the rewards and benefits of that a couple of years later after we employed this framework. I do remember a few times walking into our CEO's office and taking articles. So I definitely took the Wellbeing 2.0 article to him and, asked him to read it, and then had a discussion about it. So between, understanding their language and then also teaching them our language, I think that's really important to work with the executive leadership.
Yeah, I think it's very important that we as physician leaders do speak that language and can translate, our needs for resources into language that CEOs and non-physician administrators can understand. And so I think the next generation of physician leaders will need to be able to talk the talk, to be in those C-suites to make those decisions. So I'm glad you highlighted that. In closing, are there any other pearls of wisdom that you'd like to share with our audience in any way in terms of their journey towards, joy in medicine?
I would say don't wait. So many of us are kind of resigned at the problem of burnout. It's like there's this huge mammoth problem. What am I, one person, going to do about it? And I was there for sure. I've been burned out multiple times in my life. And it's hard to want to be motivated when you're burned out. One of my favorite people in the world, Dr. Kathy Pipes, who's also a faculty member and really a mentor of mine, she wrote a book called The Doctor's Dozen, which is a really amazing book. She says, burnout isn't an excuse for us to stop caring about ourselves or our organizations. It's an invitation for us to assume leadership and to try and change our organizations. And if we keep waiting for Godot, we wait for somebody to come and fix our problems, most of the time that person's not going to be a doctor. It might not be somebody who has even had any kind of clinical experience. And so if we don't rise up and start to take on these leadership roles and tell others what needs to be fixed based on our experience, there's nobody better than us to do that. And so I really invite our listeners to don't wait, be the change, take on the leadership roles, even if you start as a well-being champion. I started as somebody who was just lecturing or giving didactics about well-being in our CME. And I was approached by our leadership, asked to be medical director of well-being, because we had leadership that had a vision. They understood that this was important. So, even if you're just giving people free yoga or free food, that's a start. So I don't want to put that down, but be the change. Don't wait. It starts with caring. One thing I've learned, which is still something I'm learning in life, and I feel like I'm going to be learning about this my whole life, is change registers as pain. Whether that's for us going through a new job or a new life experience. We just moved, or even, losing a loved one. Change registers as pain. Even if it's positive, it's going to register as pain. And so in an organization, when we're trying to change things, even if they're improvement efforts, we're going to encounter resistance. And that's certainly been the case in my organization. And I've had to learn a lot about leadership when it comes to change, and how do you frame things within the intrinsic motivators? How do you communicate that this change is going to give people more voice and input, more autonomy and control, or is it going to help them grow, or is it going to help them feel like they have more meaning at work? That to me was a beautiful language to also learn, other than learning the language of leadership. Really, the biggest takeaway I would encourage everybody to take from today is intrinsic motivation. If you're not experiencing intrinsic motivation in your workplace, then you deserve better. You deserve to have a voice and input in your job. And we all have a role in bringing that motivation to our workplaces. And there's so many amazing resources that we highlighted today, and people we can plug into to make that happen together as a community, as a team. We don't have to function as lone riders. We can definitely function as a herd of well-being leaders.
Yeah, I think that that's a very, very powerful statement that you just made, that we can all do this together. I appreciate those pearls of wisdom. Well, I think I'd like to close today and thank you, Dr. Chaabo, for being with us. I'd like to thank our listeners for tuning in today. Please check out the episode description to explore the resources mentioned in today's episode. And until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.